Fine. We will talk about whitening because that's all you ever care about, and that's all your patients care about is how do I get my teeth super white? I'm Janae, and this is Daily Dental Hygiene. Today's topic is going to be about whitening. Patients will literally have 4 teeth hanging on for dear life in their mouth, but have the audacity to ask what whitening gel is the best to keep their teeth white. I give up. No, I give them tips and tricks that are awesome for whitening, but on top of it, secretly keep their teeth absolutely healthy. So people always kind of assume that I whiten my teeth a bunch. I have very white teeth, but I really honestly don't whiten my teeth much. I really don't use strips and gel very often, probably 3 times a year, 4 times a year, which isn't a lot, and I just do it for like a special occasion like a wedding or Christmas or something like that. But I really don't whiten my teeth on a weekly or monthly basis. I just use my little tips and tricks instead. Disclosure here, I literally drink coffee every day. I love tea. I have an entire pull-out drawer in my kitchen of all my assorted teas. And if you know me and you've ever even seen my Instagram page or ever had a conversation with me for 30 seconds, you know I love my wine. Here is my wine wall. I love my wine. All these things are terrible for your teeth. They stain. But I'm not going to give up my coffee, my tea, and my wine, and I don't expect patients to do it anyway either. Scolding them and saying coffee's bad for your teeth isn't going to do anything. They're still going to drink coffee because they're tired in the morning and they got to get their kids to school and deal with their career. So stop telling patients to not drink coffee, tea, or wine. Instead, give them tips and tricks. It's all about compliance. So make things easy for them. So the number one product that I absolutely love that I just discovered about 2.5 months ago, because I do get really bad staining in my teeth, is Sensodyne Advanced Whitening. This is incredible. They even have one, it's called like extra whitening, whatever. But I love this. I love this product. I'm not even paid by Sensodyne or anything. I love this product. It works really, really good. I love Sensodyne because if you know anything about dentistry, you know that Sensodyne is a very safe toothpaste to use. It's very low in abrasiveness. It's not rough on recession or crowns or implants. Lots of whitening toothpastes are very gritty. They're super, super gritty. And grit is not good for your teeth and your gums. Think about it. Ladies, when you go to get your nails done at the salon, what do? They buff up the surface first, right? Why? Because the fake nail will stick better to your nail when it's a buff braided surface. Same with stain, same with bacteria. If you use super abrasive toothpaste to whiten your teeth, you now just cause microabrasion for bacteria and stain to, voila, stick better to your teeth. That is an endless cycle of using gritty toothpaste in order to counteract all the stain and bacteria. Sensodyne is awesome because we know that it's okay to use on all types of mouths. Abrasion, abstraction, all those, areas of recession, implants, crowns, fillings, bridges. It's totally safe to use on it, and it's not going to affect or hurt the porcelain in their mouth. So I know that if I give this product to my patient, all their needs in their mouth are going to be met. It also has the number one ingredient for sensitivity, which is potassium nitrate. We know that potassium nitrate is incredible because potassium nitrate gets into the nerves of our teeth and it stops the signals to the brain that there is sensitivity. On top of it, it also has sodium fluoride. Sodium fluoride is great because it occludes the tubules and stops heat, air, cold, water from getting into the tubules and stopping, it stops all that pain as well. So we have one that covers the tubules and covers the nerves, and then we have one that tells the nerves, hey, there's nothing going on down here, don't worry. So 2 great ingredients to help with sensitivity, which is a huge aspect in using whitening products. They always make your teeth super sensitive. So when I do go to use my whitening strips once in a while, I really have way less sensitivity because I'm using Sensodyne and it has those 2 ingredients, so I can keep my whitening strips on longer, and then I'm not like sitting in gosh awful pain for like the next 3 days hoping that a gust of wind doesn't hit my teeth, and my sanity is saved. My other product that I really love, I talk about this all the time, hydrogen peroxide. Hydrogen peroxide, you probably have it under your sink. It's that big brown bottle that has dust covered in it and you have not used it since 1987. So pull it on out, it works incredible. Hydrogen peroxide is one of the #1 ingredients in teeth whitening. So with that being said, swishing with hydrogen peroxide every day is going to help those stains not stick to your teeth. What I do is, because I'm a super lazy human being, is I add hydrogen peroxide to my mouthwash. I literally will have my big mouthwash and I'll fill up about 25% of my mouthwash with pure hydrogen peroxide. So that, first off, I don't have to taste hydrogen peroxide because that is not a good flavor profile. Trust me, I drink wine. I know a good flavor profile. Hydrogen peroxide's not one of them. But it's already in my mouthwash and then I don't have to taste it. I also don't have to think about every single day adding hydrogen peroxide to my cup that has my mouthwash in it. It's already mixed in. I don't have to think about it until I buy a new mouthwash container in like 2-3 months. So super easy, super convenient. Once again, if it's convenient, if it's easy, you're gonna do it more, your patients are gonna do it more. What I also love about it is if you go to add like a little bit of your mouthwash into the reservoir of your water flosser, it already has hydrogen peroxide in it. And I always tell patients to add mouthwash and a little bit of hydrogen peroxide to your water flosser. But if it's already built into your mouthwash, boom, one less step equals more compliance. So these are the products I use on a daily basis that really help with my staining. I've noticed a massive significant difference in the last 2 months just using these 2 products. What's nice about the Sensodyne whitening toothpaste is it comes in a 4-pack at Costco. So if you have a Costco membership, awesome. You can buy each one of these products at like CVS, Target, Walmart. Very easy products to buy, and they're very safe on your mouth. We know that hydrogen peroxide is able to kill bacteria, viruses, fungi, and COVID. So think about it. If you're swishing every single day with good old hydrogen peroxide every morning and every night, you're disinfecting your mouth way better. And that is gonna equivalently lead to being less sick. So not only are you gonna get your patients to start using it because they want whitening, you're also, as a result, gonna get them in a fluorinated toothpaste that's gonna help with their sensitivity and something that's gonna disinfect their mouth super well. Everyone wins. They win, they're happy. The more they see the results, the more they use it. You're happy because their gum tissue looks incredible. Your patient's not in pain when they're sitting in the chair. You're able to do a better job. It's a win-win. So with that being said, these are my whitening tips and tricks. I use these on a daily basis. They're just a part of my regular routine and they work great.